mga pagsubok, kayo'y laging tumutok.
Kayo na ang laging kapay hanggang sa magtagumpay.
Salamat, salamat, salamat sa RTN. Hindi malilimutan, gintong alaala ng ating pagsasama.
Cerebral palsy is an umbrella term for a group of neurological disorders that affects muscle movement and coordination. Now, this physical disability is often seen as early as childhood. It's caused by abnormal brain development or injury of the developing brain. And as a result, the part of the brain that's responsible for movement, coordination, and posture is affected. And in most cases, brain injury that leads to cerebral palsy occurs during pregnancy. Today on the show, we'll learn more about this condition, how it's diagnosed, treated, managed, as well as prevented, and what's the long-term outlook for people with the condition. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. Cerebral palsy is the most common motor disability in childhood. And as the name implies, cerebral means your brain, and palsy means a weakness or maybe a problem using your muscle. Based on recent studies, though, an estimated 17 million people in the world are affected by cerebral palsy. Our guests are here today to help us better understand this condition. With us is Dr. Ludela Calotes Castillo. She's a pediatric neurologist and neuromuscular specialist from the University of the Philippines General Hospital and Manila Medical Center. Also with us is Dr. Teresita Joy Evangelista, who is the head of Rehabilitation Medicine Division at the Philippine Children's Medical Center. Cerebral palsy. Now, except for its mildest form, cerebral palsy can be evident in the first around 12 to 18 months of a child's life. And signs and symptoms can vary from one child to the next, and they can range from mild to severe. They can also become more apparent over time and based on the type of CP that the child has. Now, the most common type of cerebral palsy is the spastic type. It affects approximately 80% of patients. Now, my first question is para kay Doc Ludi. Could you tell us more about this more common type or most common type of cerebral palsy?
Usually po, we notice them that they're stiffer than usual. And that with that stiffness in their limbs, they can have really difficulty early on with their motor development. Nahihirapan silang mag-roll, minsan umupo, maglakad. At ito sila, kadalasan din, lalo na pag ang stiffness ay buong katawan, nagkakaroon din sila ng ibang comorbidities katulad ng seizures or learning disability.
Dr. Ludi, you bring up a good point because I'd like to ask, aside from nahihirapan mag-roll or nahihirapan maglakad, ano pa ba yung ibang mga basic challenges ng mga patients with spastic CP?
Unlike sa isang normal infant growing towards the first 2 years of life, for example, maraming challenges pwedeng mangyayari sa isang bata na may CP. Aside from movement, they can also have learning problems. Kasama dito yung speech delay because sometimes ang iba sa kanila may hearing problem as well, no? And some will also have difficulty po with vision.
Mobility issues are certainly one of the most common problems. So something as simple like what you said as walking or crawling out of bed can be very difficult. And in some cases, a child with CP can experience pain. So let's explain that a little bit. Dr. Joy, bakit kaya nangyayari ito?
We sort of measure the children with CP versus that schedule or what we call the developmental milestones. We check if they are delayed in the different aspects of development, no? From gross motor, yan na nga, yung sitting, standing, walking. Fine motor is the use of the hands. And also, as mentioned, speech and language. And also self-help skills. No? They can develop spasticity, which is actually very common in these children. About 60% of them have spastic muscles. Spastic muscles, most people don't realize, are also painful muscles. Because kung you try to stretch the muscle, pag pinilit mo siyang stretch, it becomes painful, no? So that the child will wince or iiyak siya, no, when you try to stretch a painful muscle. That's why you should also address spasticity.
Dr. Joy, talk to us about the way that you assess a child for therapy, a child with CP for therapy.
The team is composed of the doctor and the different therapists. The physical therapist usually takes care of or focuses on the gross motor abilities of the child, and the occupational therapist focuses more on the fine motor skills and the self-help skills of the child. So, tulong-tulong yung buong team in helping the child achieve yung mga milestones which are expected for that age. And it is through play para siya ay encouraged, no, to come for therapy. It is in the form of play. Kaya ang tawag sa kanya, play therapy. And the evaluation is always individualized. The doctor makes the evaluation and also the therapist make their evaluation. And together, the team creates a program for the child, and we reassess periodically if these goals are achieved or still appropriate for the child.
Occupational therapy, of course, not only benefits the person with cerebral palsy, but also those around him or her. Now, Dr. Joy, meron bang tamang age para mag-umpisa ang therapy ang isang batang may CP?
The earlier, the better. If you suspect that there is some problems or delays in the child, please bring the child right away to the doctor, pediatric centers, no, for assessment and evaluation.
Some children with cerebral palsy also have problems controlling the muscles in their face, their tongue, their jaw, as well as their chest. And that affects their speech, among other things. Now, Doc Ludi, could you tell us more about these type of challenges naman?
You look at the overall development of a baby. Therefore, speech actually is of course, we know it's an important milestone, and this actually should be should follow, no, the oromotor function of the baby, meaning the baby should feed well first, should be able to swallow well first before he's able to speak properly later on. Okay, so this should be actually picked up early. The difficulty should be picked up early so that there would be more chance of recovery later on.
Now, Dr. Joy, given these speech problems, what type of therapy or support is available for children with CP here in our country?
We have very good pediatric centers all over the Philippines, no? And the training centers are also very good. Sabi ko nga sa mga patients though, and the parents rather, that maraming karpintero, pero hahanapin mo yung karpintero na magaling dito sa bata. No? So, please look for the centers who are very good for children.
Now, there are also those with cerebral palsy who suffer from neurological problems. Doc Ludi, can you help explain what these are naman and why they happen?
Cerebral palsy, as you said, no, a group siya of disorder because the brain experiences an injury or an insult early when the time that the brain is still developing. So therefore, any cause po, whether nagkaroon ng early infection ang baby, or there was an infection in the mom's womb, or there was a problem po sa oxygen, nagkaroon ng problem with birth. And that is actually the most common cause, no? Birth injury or birth problem. So these are the other common causes of cerebral palsy.
A cure for cerebral palsy can still be a challenge. Physical, occupational, and speech therapy are among the ways to help improve the quality of life of an individual affected by it. Coming up, factors that put a baby at risk for the condition. Your health comes first here on the program. You're watching MedTalk Health Talk on CNN Philippines. We're your partner in healthcare on MedTalk Health Talk. I'm Dr. Freddy Gomez. There are certain factors that put babies at risk for cerebral palsy. Doc Joy, we want to begin with one of the more common risk factors is that of low birth and low birth weight. Now, what's the science behind these two factors?
Okay, so it's very important that the mother stays healthy during her pregnancy. So she should go for regular prenatal checkups so that the obstetrician can monitor her weight and the child's weight and her condition and the child's condition. And then during delivery, it should be assisted by competent professionals. And then after delivery, you can still have cerebral palsy, but there should be an anticipatory reaction to any problem or little observations that may be seen in the child which appears to be not expected in the child.
Doc Ludi, when it comes to the risk factors, are there ways na yung mga mommies will be able to prevent this? To make sure that the brain of their baby suffers the least amount of risk of brain injury as possible?
Pinakamahalaga po na period is the first 1,000 days of life. Actually, that includes po yung pagkabuntis. Kasama na doon day 0, day 1 po yun, no? So after birth, there are a lot of things po that we can do, no, to prevent brain injury and possibly cerebral palsy as well. So ano po yun? To keep baby healthy. That's the general overview po. Tamang sustansya, magpabakuna on time, optimize babies safe play na hindi po magkaroon ng head trauma, hindi mahulog, or any form of injury.
RH incompatibility is also a risk factor for cerebral palsy. Now, for our viewers, RH incompatibility occurs when a mother's blood type is incompatible with her baby's blood type. Dr. Ludi, pag-usapan naman natin yon. Is that a strong risk factor for cerebral palsy?
It can be a risk factor, no? It can be a risk factor, but with good prenatal care, the OB team can actually, the OB and the pedia can actually help reduce the risks to babies' health as well, no? So it's not actually the most common cause. Ang most common cause is difficulty in delivery, no? Yung nawala ng oxygen at saka blood sa baby's brain. But it can be po a cause.
Could you talk about some of the illnesses that a mother can have during her pregnancy that can affect or that can influence a child having a CP?
Si mommy can also be infected early on, no, in the during the pregnancy. So with viruses such as yung tinatawag naming torch. So yun yung may toxoplasma, rubella, yung beke, mumps, chickenpox, at saka measles. Kadalasan po sa kanila ay preventable, no? Magpapabakuna si mommy, hindi po nakakatakot or hindi po yun contraindicated na magpapakuna during or before po pregnancy for MMR, and then flu, even flu, no, vaccine during pregnancy. So yun po ang isang step na pwedeng ma-prevent ang isang infectious or like a viral infection in the brain that can cause cerebral palsy.
When we return, devices, medicines, and other possible treatments for cerebral palsy. We care for the growing needs of our community. You're watching MedTalk Health Talk. Keep it here on CNN Philippines. Cerebral palsy refers to a group of disorders that affects muscle movement and coordination. And in many cases, vision, hearing, and sensation are also affected. I'm Dr. Freddy Gomez, and welcome back to the program. Dr. Ludi, what are some of the medications given for a child with CP, and how is it usually administered?
Usually, ang common na mga medication that we give would be baclofen. We can also give clonazepam, diazepam. Sila po yung mga common terms that we actually give. And because there are also other problems in these children, we also treat the seizures as well.
Dr. Joy, is surgery ever an option sa mga batang may cerebral palsy?
Yes, we also have the injectable medicine, the botulinum toxin, which is very well used now for spasticity. Surgery may be an option if there are fixed deformities already or merong joint dislocation, then we may refer the child for surgery. if that particular deformity or joint dislocation is getting in the way of the acquisition of the skill, especially standing and walking, then surgery may be a consideration.
What about the family support, the support system ng isang batang may CP? What is it like, or what advice can you prepare the parents?
We always deal with the parents. They're very crucial in the development of the child and the healing of the child. We always say that the child does not know that he is not normal. So treat them as normal as you can.
Now, Dr. Ludi, speaking of limitations as well, what type of physical activity can a child with CP engage in safely? Of course, every parent wants their child to be able to play with other children as well, but we have to set some limitations or realizations para sa mga parents.
It depends on the degree of brain insult or even the severity of cerebral palsy sa simptomas nila. Kung minsan po, isang kamay lang, isang side lang po ang disability. Minsan po, mild lang din, konting difficulty lang sa walking but they can walk. So now that in that case po, it should be tailor fit.
Now, before we go, Dr. Ludi, do you have any advice for our viewers, especially those who have children with CP?
We focus on the ability, and the moment po that we're able to recognize the needs of each of our patients with cerebral palsy or our family with cerebral palsy, then we will be able to understand what they are capable of doing po, and what are the things that they like to do or prefer to do as well. So I think for each family, for each patient, what would be best is different.
Okay.
So it should be tailor fit.
Yes, I agree. And Dr. Joy, if there were 3 things that our viewers would take away from this episode on cerebral palsy, what would it be?
Well, number 1, don't lose hope. Okay? And I have actually 2 students. No, ma'am, do you know that I have cerebral palsy? One is a dentist and one is a doctor. So now they're dentists and doctors. So they were able to achieve very high functions despite the cerebral palsy. Okay, so these children are blessings. We need the parents to support them, the whole family actually to support them. And as mentioned, that there is hope for them to lead very full and functional lives.
Now, cerebral palsy affects each person in a different way. Families will have different experiences, but whether the case is mild or severe, there are a number of ways that parents especially can help their child achieve their best. With that, I'd like to thank our guest for today, pediatric neurologist Dr. Ludela Calotes Castillo and rehabilitation medicine specialist Dr. Teresita Joy Evangelista. Marami pong salamat, doctors, for joining us today. Thanks for watching our program today. Be safe and healthy. I'm Dr. Freddy Gomez.